We have a very special guest now, Dr. Hiren, CEO at SL Raheja Hospital, is now with us. Hiren, Pankaj this side. First, if you could just start by, how things started on the COVID front, how people were getting worried about medical infra. But now, probably things like home quarantine, more facilities starting every day. How are things getting better day by day?
Well, Pankaj, today is actually the 100th day when we have started our COVID isolation facility. And I would like to divide this phase into three parts, The first part was from March till end of April. Then I would put another 45 days from say May to mid-June. And from 15 June onwards after the post-lockdown phase. The first part was a part of severe uncertainty. We didn't know what to expect. The only thing which we knew was what we are seeing on the screen from USA and Italy and UK, and frankly speaking, everyone was petrified. We didn't know exactly how to do it. And we were getting a lot of calls from our friends and colleagues from UK and US. And that's how we started our whole system. We, even our hospital, we have, it's a vertical building. So what we did initially was we made our top floor as our COVID isolation floor. And we created a green corridor for patients who would come directly in from an emergency gate. It's separate from the other patients with a dedicated lift going only to that floor and all that stuff. Initially, all the healthcare workers were very scared, I had a lot of tough time talking to my nurses, to my housekeeping people, and even my non-clinical staff to report to work in the first place. We had a lot of absenteeism at that time, and they used that excuse of a lockdown, can't come, and all that stuff. So practically, I was working with almost 50% of my staff, and that resulted in a situation where we were, though ours was a 150-bedded hospital, I was only working with about 50 odd beds. But from that time till now, things have changed. Now people have started accepting this as a new normal, and they are not scared anymore. We are now back to 100 COVID beds. And as I talk to you, I have a full 992 beds which are occupied, and only 8 beds which are still vacant. Again, I would like to tell everyone this is a sign of that Mumbai is improving. About 10 days back, we used to be chock-a-block full and have a waiting list of 20 to 30 patients. As of today, I don't have a single waiting list and I have got 8 empty beds. That is a good sign for Mumbai. Hello, can you hear me?
Right. See, nobody can ever, prepare for... Right. Nobody can ever prepare for, such sort of a pandemic or, the sort of health infrastructure which is needed to immediately fight such things. But what do you think will be the learnings, across the globe from this? You think a lot of investments into health infrastructure will start to come in? Will that be something that a lot of countries would start to invest in?
See, if you see typically the infrastructure in healthcare in our country is more tilted towards the private care than the public hospitals. And even though the public hospitals which are there are more in the urban areas than in the rural areas. So that would always remain. And of course, we will have to have more investment in the infrastructure and create more space in the public healthcare system, because that is the way it's going to continue, because only the private healthcare would not be in a position to fulfill the needs of the masses.
All right. Okay. So glad to hear, Dr. Hiren, that things have become a bit better. You have, in fact, now a few empty beds as well. But Dr. Hiren, do you think that India, Mumbai is, prepared in case of there being, of course, we still haven't finished with the first wave, unfortunately. Delhi is now surpassing Mumbai as well. But do you think that we would now be better prepared to tackle any other second wave that could possibly occur, and also in terms of the materials, the PPE kits, all the infrastructure required, do you think that we're better prepared now?
100%. We are definitely better prepared now. And if you see in the beginning, like I told you, we were fighting against a lot of unknown enemies. Like for example, we didn't know first of all what works, what to do. The PPE kits were not available, and even if the standard of the PPE kits was varying, one day you would get a good lot, one day you would get a pathetic lot. But now that is gone. Now I'm getting a very good and a consistent supply of PPEs. So all my healthcare workers know that the hospital, when they come and see the patients, they will have adequate PPEs to work with. So the fear has gone out of them, to treat. And that has made a lot of changes. We saw a couple of our medical colleagues and healthcare workers falling ill in the beginning. But now that is not there because now our understanding of the subject has become better. The infrastructure which the MCGM has done in Mumbai is taking care of everything. We have the way they have divided it, having the CCC centers for asymptomatic patients, then having only a DCH hospital which will look at mildly symptomatic patients, and hospitals like us which have got a better infrastructure and equipment looking at the most serious patients. That has made a lot of difference, and in fact that is what has reduced the mortality. Because as we speak, today being the 100th day, I have already admitted 655 patients in my hospital. That's roughly about 1% of the total positive number of cases in Mumbai. And my mortality is only 19 out of that. So it comes to hardly 3%, less than 3%. So if you go look at that, we are doing definitely a better job now than what we were doing earlier. And we are definitely better prepared now, even if the second wave comes, because the number of beds which have been added are really helping.
All right. Great. That's good to know. Our best wishes, Dr. Hiren, to you, the entire staff at the hospital as well. Thank you so much for joining us today on ET Now.